Welcome to this session. The name of this session is The Progression of Symbiotic Family Professional Partnerships in Systems Building. Just a couple of housekeeping items to remind you for today to go ahead and mute your cell phones or put them on stun, however works best for you. This session is accredited for continuing education. The continuing education information is available on the conference website, the mobile app, and at the registration desk. So now it's my pleasure to introduce our two speakers today. Janet DeGeorge lives in Boulder, Colorado with her husband Joe and is the mom to 3 daughters, including her now adult daughter Sarah, who is deaf and hard of hearing. She's a co-founder and part of Hands and Voices headquarters, serving as the executive director since 2011. Ms. DeGeorge is the author on the chapter for family support in the AMCHP, National Center for Hearing and Assessment and Management e-book, and the co-author of the book Educational Advocacy for Students Who Are Deaf and Hard of Hearing, as well as many other publications. Ms. DeGeorge has received a program certificate from the MCH Public Health Leadership Institute in 2011 at the University of North Carolina, Chapel Hill. Janet currently serves as principal investigator for the Hands and Voices Family Leadership in Language and Learning project, as well as on the AMCHP Family Advisory Committee as the chair on the Family Advisory Committee. As an EDI systems advocate, Janet believes in the guiding philosophies of Hands and Voices towards a parent-driven, professionally collaborative approach when supporting families in the early years. Her areas of interest include leadership development for parents who participate in systematic improvement, preventing child abuse and neglect, and parent-professional partnerships in the quality improvement process. Our second speaker is Allison Ward. Ms. Ward earned an MS in health education in 2008 through Utah State University and became certified as a quality improvement advisor by the Institute for Healthcare Improvement in 2015. For the past 13 years, her career efforts have demonstrated commitment to improving public health through health promotion, education, research, policy development, evaluation, and grant development from the community to the national level. Ms. Ward's position and interests provide her with broad and valuable experiences in public health. Early on, she worked in tobacco cessation, injury prevention, and employee wellness. Currently, Ms. Ward is engaged in learning systems development, for example, coalitions, learning communities, and collaboratives, and children's health research in environmental, viral, and genetic factors. As the Director of Quality Improvement at the National Center for Hearing and Assessment and Management and MCHB-funded Technical Assistance Center, she is also the project coordinator of the CMV, or Cytomegalovirus Public Health and Policy Conference, and serves on the board of the National CMV Foundation. I'd like to welcome everyone and welcome the speakers to begin the presentation.
Good afternoon, everyone. We really appreciate you taking the time to be with us, and hopefully your stomachs are made of steel, because I do think it's about time for lunch for most of us. So thank you again for coming. Vicki did an excellent job of presenting who both Janet and I are. I gotta remember to use the right remote here. And I don't think I need to introduce myself anymore. I feel like that's always a lengthy introduction. So I'm gonna go to the next slide, and Janet can say, oh, let's see, sorry, we switched the order of our slides last night, so that's never a really great idea. So in terms of symbiotic relationships, so when Janet and I were putting together this presentation and putting together our abstract, we kept trying to find words that really signified what we believe that we have in our partnership. And the word symbiotic rose to the top. And symbiotic or symbiosis really is a relationship of mutual benefit, beneficence and or dependence. And so we've really come to a place, and this is what we're going to be talking about throughout our presentation, that we both really rely on one another to create an effective system. And that's been over a process of many, many years, and we'll talk a little bit more about that progression later.
Good afternoon, everybody. For those of you who are watching on videotape today, there are literally hundreds of people here in the audience. So we're glad that you can also be a part of this experience. Thank you. So I am going to stop on my slide. I know Vicki introduced me, but I just have a couple things I want to say. My daughter always loves to say, you know, Mom, you wouldn't have a job if it wasn't for me, which is pretty much true these days. But we are really excited to be here. And I think for us, first of all, I want to thank AMCHP for the opportunity for us to come and be a part of this experience over these last few days. I want to thank you as the audience. I know that you have many options of different sessions that you can go to. And for each of you individually, you know, we spent a lot of time preparing our slides. And we understand that it's really not what we say to you today, it's what you can take from the presentation that will be helpful to you in your work. So we are really happy to be here. I always love to start with an uplifting, inspirational quote. So here we go. It's not easy for us as leaders to give up the experience of ourselves as being burdened by heavy responsibility and immense complexity. It is not easy for us to accept the possibility that we do not have to be burdened and that we play a central part in whether or not we are burdened. So I know that's not completely uplifting, but I think so many of us experience the tension between wanting to do good work and the complexity in which we do our work. And we thought for today what we would do in terms of exploring the parent-professional partnership is not at the individual level. I think we have a lot of information about how to engage families or how to find families, but we wanted to explore it from an organizational perspective, from our organization of a parent-driven organization to a professional organization and how that has evolved over the years, including beginning to help define the terms around parent-professional partnerships.
Okay, so just a little bit about how we've organized our presentation. I don't even want to say presentation because we'd really like it to be as interactive as possible because that's where we feel like there's a lot of systems building when there's a lot of, questions being asked and a lot of conversation back and forth. But we're going to tell you a little bit about our story, talk a little about key terms that we use in our work. And then on the center of each of the tables, we've put the partnership continuum. And so if you would each take a copy of that, kind of perseverate it as we move through the conversation. And then toward the end, we'll talk more about your story. What's a partnership that you have and what does it look like and what would you like it to look like? And so we'll spend some time talking about that and then opportunities to share out.
I wanted to just take a minute to talk to you a little bit about Hands and Voices. We're a parent-driven, professionally collaborative organization that's been around for over 20 years. Our mission is to provide support and information to families who have kids who are deaf and hard of hearing. We have a very unique, targeted population of families that we serve. We are, from the very first time we sat around a kitchen table, there were both professionals and parents at the table in those early days. And yet, I would say, in terms of talking about being parent-driven, over the last few days, I've been hearing talks about making sure parents are at the table, and I was thinking about us at Hands and Voice, and I think, you know what, we're not at the table, we are the table. You know, in fact, we have had to do some training within our organization to help professionals understand their role in that partnership as a secondary support. And the professionals that we have in our organization are so passionate and love to be a part of who we were. But from the very beginning, we didn't want our DNA to be a reactive-based parent organization in terms of the experiences that drove us often to be at tables. We did not want a negative-based approach. We know personally as a parent, my daughter would not be where she is today without the impact and influence of the professionals in our lives. So we understand that very nature of collaboration is in our own DNA as parents. I would say, though, that as we moved from a very grassroots organization, which was really about supporting one another into systems representation, that we understood that as we were approaching others' tables, that yes, it's our table in terms of, at the end of the day, whatever systems are being established have to work for our kids. But one of the things we'll talk about more today is that ability as partners so that the relationship together, that we're working together to improve the system. We have a long-standing history of and we understood early on that it wasn't just about starting chapters in our organization. You saw the map where we have over 47 chapters in the US and Canada, but we also had to create leadership opportunities for families, including running a business, a nonprofit business. We also use our resources among us. So even though we have a headquarters with chapters, really so much of our learning and wisdom comes from the chapter level. For the first time in our history, we've had to put a mandated description here below. We have been around for 20 years and have never been recipients of direct federal funding. We've had subcontracts prior to, but this past year we're just finishing up our year as direct federal cooperative agreement for the family leadership in language and learning. And we have some, the thing we loved about this the day the FOA came out was that it was so connected to the things we feel passionate about, which is opportunities for families to have family-to-family support, to be leaders in systems, to have opportunities to meet deaf and hard of hearing adults. So I made this comment the other day, and I think one of our staff went, "What?" Because I said, from the day we began till today, money and funding does not drive us. The passion that we have and the things we know that are important to us drive us. And I said to somebody, we'd be willing to walk away from any funding pot if it didn't serve our purpose as well. And that's when she said, but I really like my job. So anyway, we think about parent engagement. In fact, hopefully this is the last time I'm going to use that word in this meeting today, because I think sometimes we begin to use terminology that becomes cliche. But we've always thought about our involvement as families at 3 levels. First, for our own kids. Then in terms of parent-to-parent support, the power of what we have learned raising our child and how that can help others. And then parent participation through advocacy in the system. So that's just one of our things. So I'm going to turn it over to you.
Okay, thank you. So just to get an idea of who's here this afternoon, how many of you work for parent support organizations? Okay, so a couple of you. And how many of you would consider yourself maybe more of a professional organization or a professional partnership? Okay, great. So there's a good mix. So a little bit about the organization that I work for. It's called the National Center for Hearing Assessment and Management, or NCHAM, not the most glamorous acronym ever. But we provide our primary funding comes from the Maternal and Child Health Bureau to provide technical resources to all the state and territory newborn hearing screening programs. How many of you are in your state health department? Okay, how many of you are familiar with the newborn hearing screening program? Okay, all right, good, excellent. Then I have a little bit of basis to work off of. So NCHAM does a variety of things. Like I said, we do the technical assistance component of providing assistance to state and territory newborn hearing screening programs. There's an arm of us that works for EDI information systems, so some of the data components. We do some basic and applied research, as well as some some advocacy and international outreach. And then we do have a preschool at the bottom of our building that serves kids who are deaf, hard of hearing. So we actually get to see some of the recipients of the services that we're trying to improve. So that's actually, I always say I have the best office in the world because I see the mountains from one of my windows and the preschool playground from the other. So it really is the best of all worlds. So in terms of the requirements of our specific funding from the Maternal and Child Health Bureau, we're responsible for dissemination and diffusion of best practices or things that are going well in the EDI system. Again, the technical assistance piece, and then we also provide quality improvement technical assistance. And we'll talk a little bit more about how that's such a great way to work with parents in your state or in your organizations to include them in that quality improvement process. Collaborate with federal and state entities, again, to promote family professional partnerships, strengthen family-centered medical home, and then expand hearing screening into early childhood. So there's an arm of our organization that works with Head Start programs and other preschool programs like that. Just really quick, I don't want to spend a ton of time talking about the EDI programs, but again, they're typically in their state departments of health. They receive both AMCHP funding as well as CDC funding. All 50 states have a AMCHP grant that helps fund their newborn hearing screening program. And then in terms of what they're in charge of, they really have to look at that screening piece that happens in the birthing facility, whether that's a hospital, a patient's, a pregnant woman's home, et cetera, medical home, family support, program evaluation, public awareness. So if you are located at your state Department of Health, you know all those different pots of activities that you are responsible for, keeping up on. And I think that that's one of the things the quote that Janet shared resonates. I know with me and with the states that we provide technical assistance to is sometimes it does feel like an extra thing, that family, engagement, and I'll try not to use the word engagement either because it's neither of our favorite words. But when that requirement started to roll out in the funding from the Maternal and Child Health Bureau, it did just feel like another thing. It felt like a mandated piece, and same with quality improvement. It felt like another mandated piece, and that really impacts sometimes the willingness for state programs to open up and really commit to that process. So we're going to do a quick little activity. There's pens on all of your tables, and there should be some paper. We're just going to take just a couple minutes and choose one of these terms or another one that's similar. So symbiosis, engagement, co-design, co-production, partnership. Just take a minute and choose one of those terms and then develop your own definition around that. So let's just take maybe 2 minutes here. I don't want to lose track of time because it will go fast. Vicky's not working on her definition. Yeah. I think I'm what, 20, 20, 20? Yeah, so we gotta get through this in the next, 3 minutes. Okay. We can do it. Okay, so we're going to ask for some volunteers to share their term and their definition.
And remember, your definition doesn't have to be you didn't have time to craft a sentence. Maybe just some salient words or thoughts that come to mind around that.
Oh, great, thank you.
So I'm Claire Lenker from the UAB Pediatric Pulmonary Center, and this is a definition of collaboration I heard many, many years ago from Doris Barnett, who was a public health social worker at HRSA and was originally from Mississippi. And she said collaboration was an unnatural act committed by non-consenting adults.
Excellent. Others?
Anybody else willing to share their term and definition? There's somebody up in the front, in the red sweater. Oh, sorry. Yeah.
Hi, I'm Anita from Kentucky. Partnership is cooperation between two entities to achieve a mutually beneficial goal.
Nice, thank you.
Great, thank you. Anyone else? Okay, we'll do one more and then.
So for symbiotic, the whole is greater than the sum of its parts.
Very nice, thank you.
And I think there was one over here. Did you have one?
I did engagement, and I just said knowledge of and close collaboration and involvement in a program. Shared knowledge.
Thank you. When Allison chose the word symbiotic for the title of our presentation, I said, well, you better look, I had to go look it up, and then we said, we better define that. Think of some of the words that just emerged: collaboration, partnerships, engagement. Several years ago, I'm not sure exactly, I probably Googled the term, partnership. I was developing a slide or something, and I came across a paper and some work out of New Zealand where the title of the paper is called Potential of Partnership. It's a very interesting document. It's about 140 pages long, really about one particular project in a small town in New Zealand. But one of the things they did was begin to talk about the spectrum. So often we throw the word partnership out there, and if you begin to define it down and think about that there's actually a spectrum of partnership, you can begin to not only understand it and make it more meaningful, but begin to measure it. And so the spectrum here, and we're going to talk a little bit more about the definitions, include coexistence, networking, cooperation, collaboration, and partnership. There is not a starting point and an ending point. In fact, some of the partnerships you hold may fall under some of these categories, and that's perfectly fine. But in terms of creating what we're going to be talking about in terms of partnership, creating systemic improvement often requires at the full end of the spectrum around partnership.
The other thing that I want to mention is, like Janet mentioned, it's not necessarily a progression, meaning that one level's better than another, or that all of your relationships need to be at partnership. It makes sense to have some agencies that are just at the coexistence level, or some of those other components. So we kind of have to be willing to be flexible amongst that spectrum with our different groups that we work with.
Here's a nice definition from this work about partnership. Works from an agreed shared values base, including trust, honesty, and openness, sharing of risks and rewards, resources, accountability, visions and ideas, decision-making, about the way things are done rather than the evenness or not, or power, control, or resources. And we're going to give you 3 examples in a little bit of how our partnership as 2 organizations have sought in some of these areas. Another area you may have heard of comes from some work on co-production theory. By the way, I wanted to mention that partnership spectrum. I shared that on a committee I was with on the AAP, and they took a conversation we had one day with that and went out and made a tool to use in collaboratives where there was some questions and that teams could come together and begin to evaluate where they were at. When I saw that, I said, well, I'm taking that back and deriving a tool from you that you derived from me to create what is now on your table, which is a way for you to kind of process and think about. You might just choose one organization you're working with right now to say, where and how have we defined our partnership? Co-production of the co-production theory, when I first read about this, I was so intrigued because some of the thought processes around co-production include that services should not be viewed as a product delivered, but is better conceived as a service. Services are always co-produced by service professionals and service users. And thinking about a duality of satisfaction of both the professionals and the consumers or end users. That a system in order to be effective in running has to provide satisfaction across the board. I've heard, you may have heard this before, moves away from what's the matter with you to what matters to you, and a culture of co-creation and generosity grows, productive relationships form more naturally. And so if you're interested in digging a little deeper around some of the theories of partnership, I encourage you to look at the co-production theories. It's really there's some quite remarkable thought about that.
And just thinking of the terminology co-production, sometimes you'll hear it referred to as co-design, or I saw a new one in there in the exhibit hall, the co-effective. It really is that idea of coming together and producing something together from beginning to end. So who designs from the co-production or the symbiotic relationship? Who would you say benefits from it? Yeah, everyone, right? So both the professionals, the parents or families that you're working with, or patients, whatever the case may be, and really the overall community ends up benefiting from it because it does eventually lead up into that larger systems change.
Sorry, I know we have to keep moving forward, but I just want to make a point about that because I think for me as a parent, I probably will continue to say that unless the systems work effectively for us as families to get through, the system is not effective. But until I, as a parent, went one day on a tour with some other professionals in our field to walk into the nurses' stations across our state at hospitals who were required to do newborn hearing screening, and I was literally sitting in a NICU and begin to open my eyes to the understanding of what was involved in their day. From my point of view, my thing is you better screen that baby and you better not tell that family it's only fluid in the ears, and you better not say, well, you know, this equipment's not working, and I had all these things in my head. But one thing that helped me understand those nurses, and also what my story could bring to that situation, those nurses were screening babies every day. They never got to see the end result of what their screening produced, which was a healthy, happy, early identified deaf infant. But I, as a parent, had to step across that threshold as well. We are asking you as professionals all the time to come across and understand our story. But for me to be effective as a parent partner with you in a true partnership, I have to also understand that the system has to work for those screening nurses in the hospital. And one of the ways to do it is through family story, because they began to have more of a passion for getting that done when they understood that there was a baby at the other end of it that ultimately was going to really benefit, not just that day in the nursery. So, sorry,
we could talk about this forever. So I know, and I started to think about we had dinner with our project officer last night, and Janet was saying, you know, kind of the parent piece, and I was saying also the professional piece, and that they have to come together to understand the benefits and the challenges that each of them face to really come together and say, okay, we can work on this together and we can move forward together. So thinking of, let's go back. Yeah. Okay. So I really like this quote. I went to at the Institute for Healthcare Improvement Forum, I went to a co-design workshop, and I really like this saying. So co-production or co-design makes vulnerable people powerful. So giving that patient or that family a voice, and powerful people vulnerable. So people in the hospital setting or a physician's office, it makes them really subscribe to humility and say, you know what, I'm going to step aside and not pretend that I know everything. I'm going to listen to you, and I'm going to respond to your concerns, etc. So there's a lot of, there's some shift in there. I don't know if you guys have felt it in your own specific work, but there's a shift that's moving toward patient and family experience. This report actually comes from, it's a report by the Burrell Institute that's called The Patient Experience, but they're starting to incorporate some of the employee piece to it, and that really realizing that neither of them exist on their own. So looking at the patient experience, that 56% of this population said, in specific hospitals said that they're starting to focus on patient experience. 18% said they're just beginning, and only 20% said that it's a well-established piece of their typical practice in their hospital. And then so is employee satisfaction. I think about the newborn hearings program world that I circulate in. We have huge turnover, and I don't know if in your public health programs, if you experience that same level of turnover, but it vacillates anywhere from 18 to 50% a year. And as you can imagine, bringing people up to speed, over and over and over again is hard for a technical resource center, but it's also really challenging for the coordinators that end up in those positions. And so it's looking at how can we help understand their work? How can we support their work? Because in turn, their work affects the family, affects the, how well the baby's screened and all of the next steps thereafter. So healthcare priorities in the next 3 years, both the patient experience and employee experience were actually the top two, which is a huge, huge shift for the healthcare industry. And hopefully that'll bleed over into public health as well. Okay, so.
One of the ways Allison and I created equity of partnership in this presentation is to each have our own microphone, because we both love to talk.
And both stand up here together.
Yes, together. Yeah, so let's just go through really quickly just some of the definitions around this. We were going to incorporate some examples into each, but we decided just to have it at the slide at the end. So that's really where we want to focus on here. But just here's the continuum again, and thinking about where you're at with a particular place with your partnerships. And I just have to say, a lot of times the examples that we give are how families are engaged into the medical health arena. And an example I like to give that sort of takes it to the other direction is that in early intervention, when you have an early intervention provider come into your home to work on skills, like for example, with a deaf child, maybe language development, that 30 minutes a week, even the fact that it's in the home, you could say, oh, see, it's in the family's place. But honestly, the way that system works effectively is that the service provided in that 30 or 60-minute period does not really make a difference unless the family incorporates it into their day-to-day life. So unless I understood the skills that the therapist was working on how to do that in the bathtub, and you guys are all familiar with that, but I think sometimes in the medical health industry, we still think about families walking through the doors into the medical home, or even the conversation about where is a medical home and things like that. And it's really pulling it back into how does it work for families. So here's back to the partnership spectrum. Here's just some other ways to divide up the conversation, and we'll just go through each one a little bit. First of all, coexistence. And think about this organizationally. Even for us in our little world in deafness, walking through this huge conference at AMCHP, I became aware that there's some I'm coexisting with a lot of other agencies and organizations, and it's kind of that need to know idea. Like I don't have time to partner with every single project, but I'm like, breastfeeding. There's actually something at that table around crying help that might be useful for us. So there are some times where we coexist with other organizations and entities, and that's fine.
And again, just reiterating that that's fine. Like it's not, coexistence is not a bad thing. We're not looking to have a deep partnership with everybody that we work with. Okay, networking. Do you want to?
No, that's you.
Oh, okay. Oh, I forgot we flip-flopped. Okay, so in terms of networking, how often are you at a meeting that we say, oh, we're now going to just have networking time? Like, I feel like that was like something that was huge about 10 years ago, and we still hear it, or it's kind of planned into the schedule of a lot of the conferences or meetings we go to. But it's really that idea that we're having a discussion, we're meeting, we're kind of tossing out ideas, but how often do those ideas end up, how often when you collect somebody's business card at a conference that you actually follow up with them and start to work together?
Every time.
No, no, you know, I'm gonna call you out on that. I mean, it really is just kind of that informal meet and greet. I know you're here. It's just that kind of next step of understanding what one another does. Yeah.
Thinking about cooperation on the spectrum, all of a sudden you're cooperating with another organization. You may have some common interests, issues, and agendas emerge. Some documentation may exist. Parents and families are formally working together. And then one of the things I put in terms of differentiating a higher level is often and I think this comes up often in this discussion, which is often parents are asked to be a part of a conversation or a project, and yet they're not actually there at the inception of it. And we'll give you an example in a minute.
Okay, so collaboration, I heard that word in some of the definitions that we talked about a little bit. Collaboration is where you're starting to develop trust and you're starting to negotiate agreed upon actions, that there's some shared decision making around goals or objectives that you're working toward. And then some things have to be given up. Going back to that saying earlier that you have to sometimes be willing to say, you know what, maybe this isn't that important that we get this, or that maybe it's more important that we come to a space where we both agree and nobody necessarily wins their way. And then commitment to vulnerabilities and challenge issues. We often experience with our partners or other programs in our agencies that we have the same challenges, and coming to a space saying, you know what, I experienced that too, let's work together and see if there's a way to overcome it or a way to work with it. And then this is the place where co-production really starts to emerge and moves us kind of into that deeper level.
The one point I want to make about partnership in terms of risks and rewards, when you become a partner in systemic change, a partner in the evolution of a project, the reason you begin to experience risks as an organization is because you were invested in an agreed upon solution to it. And sometimes what we do doesn't always work. And the accountability of that in terms of, well, that test that we tried, or that policy that we initiated, or guidelines, may or may not work, and you do encumber some of the risk because you were part of the project in terms of the decision making.
I just want to add to that just a little bit. So we have a partner that we both work closely with that was recently told that they may be losing their funding. And initially, I had the empathy of, oh, God, that really stinks for you guys. But then I also realized it affects all of us, right? That it affects us at our agencies. It affects the families that get screened, the services that are out there, the tools and their products that they've helped develop. And so I sometimes don't know if that message gets back to funders that really we're all working together. And in more than any other program that I've ever worked in, the EDDI system has really a deep level of partnership and commitment to one another. And it almost feels like a family. I mean, I know that sounds kind of cheesy, but it really does. It feels like, Janet's like my left arm and Vicky's my right arm, and and we just really work together nicely. And so it's a beautiful relationship.
That being said, the tension for us as a family organization is that we are sometimes both the watchdogs and the partners within in the system. At some point, at the end of the day, in fact, in the work of where this work came from on the partnership spectrum, they said sometimes collaboration isn't the answer, it's advocacy. And those two things are not diametrically opposed, but we wanted to give you a couple examples of this. And there have been times in our partnership where we were at a table, and this is where honesty and trust really had to come to play. because there were some high-level decisions, like even sometimes thinking about seeking funding. Which one of us as the partner is going to seek this funding? In other words, sort of be the owner of that pot of money of funding. And so, so we wanted to just give you a few examples around our meetings that we developed together, some of our grant partnerships, and our quality improvement initiatives. When we began our really coexistence with one another in AMCHP and Hands and Voices over 15 years ago, we were an emerging family organization that did not have a lot of national influence, where AMCHP had already evolved to a point where they had influence funding and things like that. And so as we grew as an organization and began to make an impact systemically from our grassroots work, this is where some of our partnerships began to emerge, including funding. And I always look at funding as an interesting progression in partnerships, because when you talk about ownership of funding, there's a difference between being given some funding and told what to do with that funding. And sometimes that isn't like a control issue. It's really that the funding comes from this pot of money. It has to be spent this way. But from our point of view, as a partner, we also believe in the ability to mold and define how that funding is going to be used for our mission and purposes as well. And so our funding streams between Hands and Voices and AMCHP over the years has evolved and grown over time. And so really we've been a subcontractor of AMCHP for many years. This year, for the first time, like I said, we received a direct federal funding and a cooperative agreement. And we still have some funding streams between us, but the ownership of that funding and how it's used is now flowing a bit both ways. And it's been an interesting evolution in that. And I'll just tell you what one thing that was in our cooperative agreement, when we saw some of the things that we needed to do around a national needs assessment, we knew that the expertise in our partnership with AMCHP was held in that way. So actually, they're a subcontractor for us. Allison works for us now.
It really has. It's kind of gone both ways.
So that's one example. Let's talk about the QI thing really quick.
Okay. Just thinking of time?
Yes.
All right. So there's been a big evolution of how quality improvement has worked in the Maternal and Child Health Bureau. With the specific EDDI programs, they started out going through collaboratives that were led by NICHQ. I don't know if you're familiar with the National Initiative on Children's Health Quality. So NICHQ led those collaboratives starting in 2006, and they started to ask for parent representation. And at that point, the parent representative came in after a lot of the things had already been developed. And so it was kind of that platitude of saying, oh, we want to have you here, be the warm parent body on the expert faculty or subject matter expert kind of thing. And then over time, they started to integrate the parent voice more into the measures, more into the change package. I don't know how familiar you are with QI, but et cetera. And then it's moved, the grant for the QI work eventually ended up coming over to AMCHP. And so that's where my position came in as the Director of Quality Improvement. And we really recognized that we had some really strong parent partners that should be quality improvement advisors themselves. And because they've lived it, again, that they're the person, the family is the one that's ultimately impacted by the processes that AMCHP kind of oversees. And so we now have 2 parents that play the role of quality improvement advisors out of our 10 quality improvement advisors. So it's been a really great relationship, and seeing how that progression has moved from being the warm body in the seat, which sometimes is called as engagement. So that's why Janet and I don't always like it, is it kind of comes, it can kind of be a little bit of an empty term sometimes in terms of practice. So we've been really happy to look at some of that progression over time.
I wanted to add one thing within our organization, as parent leaders, parents that were coming to all the collaboratives, we realized we needed to build our skill set around quality improvement improvement. And not only that, was that if we were part of teams that believed in this process, then we should look at our own organization. And we went through, we had no funding for this, but we decided to do some quality improvement initiatives within our own organization. We did a pilot of 5 chapters who went through the PDSA cycle to increase memberships. The families got to choose what they were doing for quality improvement. But rather than bringing families into a new theory or model that we now have to learn the whole thing about, that sometimes we're fighting to make sure that's meaningful, we pulled it back into our own organization, said, let's practice quality improvement within our own parent organization. And that brought credibility that we could come back at conferences and we actually showed improvement, and those have now become systemic. And I just want to call out Vicki Hunning, who is our Director of Data and Evaluation, who ran that collaborative for a whole year, and the investment of those chapters and doing that was really remarkable.
Great. Thank you. So one other project that's been much more recent is, I don't know how many of you have been kind of more or less mandated to do care coordination plans or utilize shared plans of care with the children that you serve that have special health care needs. But that's something that is new for all of the EDDI programs. And as the National Technical Resource Center, we're kind of charged with helping the state programs understand what care coordination, understand what a shared plan of care is, or how they can really operationalize it in their specific programs and the families they serve. And automatically, I mean, we're not experts in shared plans of care or care coordination, and so automatically it was like, you know what? This is not an area that we know what we're talking about. We need to go and work with the American Academy of Pediatrics and get their input. And we need to make sure that during this entire conversation from the inception, the Hands and Voices is involved, because we want to make sure that this, whatever we produce, or any webinars that we that we hold, that there is the parent voice that says this is how it would or would not be useful, because ultimately the care coordination or the shared plans of care need to be useful to the family. Otherwise, it's an exercise in futility.
An example of that is Dr. Antonelli showed that care map up on the board, and we took that and rewrote it for what it looks like for a deaf and hard of hearing child, and it was really different than, I mean, every family's care map is different, but our interest as an organization in this process of shared plans of care is to ensure the integrity of its usefulness for our population. So this is one area we've been pressing a little bit from our point of view to make sure that it's meaningful for families. And
okay.
we're gonna go through really quick to get to here.
Yes. Okay. So some of the kind of build up piece that we, like Janet said, we want to make sure that we have time to explore your story, is looking at your individual experience and your system experience and why that's important to you and how that shapes the narrative or the frame of how you come into your work. And if you want to talk about what families.
Yeah, here's just a list of some of the things that are what families bring to the picture.
And that kind of moves in. Yeah, okay.
You can just go through that.
Yep. And then in terms of what professionals bring, passion, resources, diversity, sometimes it's increased legitimacy. So if you have a professional organization that you work with, sometimes it kind of increases credibility in the community. So we did kind of buzz through that really quickly because we want to spend some time on your story. So that's this worksheet that I mentioned at the beginning at the center of your table.
And we buzzed past that, and I've spent years doing full day workshops on what parents bring to the table. And if you still, I feel like as a system, we need to even move past that there should be a value already around that. So now we're going to just spend a few minutes on your story and thinking about that.
Okay. So I won't go really through this, but this is kind of a nice parody to ask, what you're asked to do and how that becomes so much more complex. So all of the slides are uploaded to the AMCHP website, so you can come back and look at some of those.
That was was a joke slide, by the way, because when she first put it in there, I'm like, "Youre Precious, sir."
I know, without
Youre
letting
Precious
users
service.
muck about with your precious service, right? Like, I mean, that's sometimes how we feel, like, oh, they're coming in to tell us what to do again. And then we always have a million reasons, way more than 50, of why it's going to be hard or why it can't be done, and learning how to move past those and go back to we have a choice whether we feel burdened or not by what we're doing with families. Okay, this is you.
Oh, you went past the other slide. Oh, the 50 reasons not to change. Thinking about honesty, trust, relationship. In our world, in the world of deafness, we have been what we call in a methodological war for hundreds of years. The tension between deafness as a medical condition versus a cultural experience has created tension in our world in a lot of ways. Our organization, Hands and Voices, came from the premise that there was more that united than divided us. And so in terms of building partnerships, we often come to the table, whether you're a parent or you're sitting with a table of physicians, or your physicians coming to the table with parents, we often come with an assumed belief about what that person is going to bring. And the way, before you can start working on initiatives or goals or tests for improvement, if there is not trust and relationship built first, it's really hard to actually get that. And right now in our industry, or when I call it an industry, in our experience, we have a new project called Common Ground, which for the first time is really bringing together a lot of the entities that in the past have been oppositional and adversarial, and really trying to begin to find what unites us. So we really do need to create relationships. Often when we've had past experiences that create barriers to trust. I know for me once, I was so frustrated with our special ed director in our school district, trying to get her to follow what the law said in our state, and I had tried many different ways and times. Finally, I felt the need to go to a public meeting where she was there, and during the public opportunities for speaking, I stood up and I said, when are you going to, is your district going to comply with the law? And I saw her face turn red, and she said, we'll take care of it tomorrow. And she did. They knew they were in the wrong. It wasn't a shadowy place. It was sort of black and white. But I realized over the course of the next year, I needed her as a partner in the supports for our kids in our district. And it took, I wrote an article once called Rebuilding Burnt Bridges, because I understood that partnership and relationship was essential to supporting all of our kids. So while I won that battle in the day, and it sort of felt good that I stood up, and in terms of partnership and trust, you have to be able to get, even if you've had experiences with somebody that's been negative, to get past that and say, okay, we're all here on behalf of our kids. What are we going to do next? So go ahead.
Okay, just one quick thing. When we were planning this presentation, I was trying to kind of map some things out, and I just kind of came to the realization that for everyone to really do their part in a partnership, it requires good communication, and that good communication requires a trusting relationship, and a trusting relationship requires humility. And I kept kind of going through that, and then on the plane ride to Virginia, I started reading the book Humble Inquiry. I don't know if any of you have read that book, and it said almost that exact thing verbatim, and I was like, wow, why didn't I read this like 20 years ago? So if anybody of you are interested, you should pick up the book Humble Inquiry. It's really interesting. So with that, we're going to move into working on the worksheet that's on your table. So if you look on the back side of the worksheet, it asks you to essentially choose a partner, an organization that you work for or with in your community, and where do you believe that you are in that partnership continuum, which is highlighted on the front piece of the worksheet. And then what barriers or challenges have you encountered, and what would it take really to move you into a different part of the continuum. And so let's spend just a few minutes on that, and then we'll ask people to share a little bit, and then we'll wrap up.
You probably won't have time to do it all, of course, so maybe just choose one of the questions that's interesting to you.
Yeah, it's too easy to not get there. Yeah. Oh, thank you. Yes. Yes, okay, thank you. How long do we want to do this? I know. Well, I think it makes it, yeah, it's the application piece. Okay. Okay. I know. I think we were thinking we were going to have more time for this, but that's okay. I like activities, though, because it breaks it up, so you don't feel like you're being talked at the whole time. Thanks. Okay, so maybe just a couple more minutes.
And just take two minutes.
Yeah. Let's say that.
Time for Q&A too.
Two shares. Oh, I don't know why my back hurts. It just does. Mm-hmm. Feel a little obsessive with the time thing. Okay, about another minute to work on your worksheet. It would work well too if you had like an estate stakeholder kind of meeting. Yeah. Maybe. She said, good luck.
All right, why don't we go ahead and pull it back together, and we're going to just take a couple people from the audience. If there's anything you want to share from looking at that, this tool, or anything that emerges for you.
Okay, anybody willing to share out? I can't do the loud whistle that the person did the other day that got everybody's attention.
How about you guys?
Oh yeah, I could do the clapping, right? Okay.
I don't like that.
I don't know if I like that either.
Okay. All right. This is your last chance. Anybody?
Willing to share an example of what they wrote out on their worksheet, or even some of the table discussion of where they're at with one of their partners and what are some of the challenges or how you can move into the next phase? Thank you.
Why not? I'm still in Kentucky.
Yeah.
What I'm finding in our state, at least, is that even within our department, we tend to isolate. Mm-hmm. I don't understand it because public health is all encompassing, but there it is. We tend to want our little cubby holes and our isolated, familiar teams, and there's so much more we can do and so much more effective we can be if we would just share information. Yes. And we are starting to do that and build on those relationships in our state with our health departments. One of the things that we've been doing is developing community partnerships and making that part of the MCH requirement, a required activity that is reportable. And part of their requirement to receive those funds. So that's helping, and they're thinking outside of the box. For example, I have a couple of counties who are going into the courts and having judges and attorneys work with clients to teach them things like abusive head trauma prevention.
Thank you so much for sharing that. And I think it is a challenge, and you have to fight for it. And I would say this is where you, as in terms of building your own leadership skills when you're inside a system that needs to push forward this. I'm going to close with my last minute. We're going to go. Go ahead, Nora. No, that's all right.
Go ahead.
Go ahead.
Well, we just quickly, I thought several points came up at our table about how difficult it is to bring family partnerships in when the initiative has already started.
Yes.
You almost have to back up and start with the beginning of the initiative. And the second thing is how difficult it is to really get representative families involved in an initiative. You almost have to link up with some kind of an organization or something that has a broader base than one or two people who are just representing their own.
Absolutely. Thank you. I want to close today with two quick stories of my daughter, because at the end of the day, no matter what table I am or what table I'm at, even after all of these years, I know that what drives me to be there are stories from my daughter's journey. So I'm going to share a challenging one and one that I just hold dear to my heart. There was a moment where I was in an audiologist's office, and she asked me to hold my daughter down while she did a real ear measurement. And she said this, and my daughter was screaming, and she said, "This is just how it's done." I was a young mom, and I didn't know that procedure was not supposed to hurt. Imagine if that's the story I led with every time I came to a table, because I have 20 other stories that are both good or challenging, but it is one of them that drives me to make sure that the process for families work. When my daughter was 15 years old, her teacher of the deaf asked her whether she would go mentor a young girl in 2nd grade once a week. So she drove her crappy car across town to the elementary school, and every week she came back home, and I said, "How'd it go?" And she goes, "I don't know if I'm really making a difference." It was a little girl who was hard of hearing who wore hearing aids. One day she walked into the classroom, and she looked across the class, and she turned to the teacher and said, "Isn't Anna here today?" The teacher looked at her, and she said, "Anna's right there." And she looked over, and there was Anna sitting in her desk, and Sarah hadn't seen her, because every time that Sarah walked into that classroom, Anna had her hood up and had always been ashamed of her hearing aids. And that day, Anna had her hood down. She was sitting up and smiling straight over at Sarah. And I love that story in my heart, because my daughter has been the recipient of services, good and challenging, throughout her life. And I love that somebody in the system asked for her to begin to give back. And my daughter is a thriving, strong, independent young woman today because of the systems that you're involved in. I want to thank you from the bottom of my heart that, yes, while we have work to do in the systems, that the opportunity to really serve our children who are growing up in whatever capacity to be thriving adults. So thank you. I know I took your minute.
No,
Go ahead.
that's okay. That's okay. I don't need a minute. Anyway, we really appreciate you coming, and just the final reminder that together we are stronger, we're better, we're smarter, we help, we serve, our communities better, and enjoy the rest of the conference and travel home safely.
And thank you, our speakers.